Oh, Devlin, you buy fresh flowers every week. That's awesome. Sharon said meditation. I know, similar to Sarah, I love being around water, whether it's an ocean, a lake, river, something, even if it's just a little rock garden or one of the fake ones that you may put in your house. I love the sound of water, seeing water. It calms me. And fun fact, we didn't coordinate this, but Sir actually used this same icebreaker in one of my other meetings yesterday, Tuesday. Tuesday, the day before Valentine's Day, is Self-Love Day. If you all didn't know that. So it's the same day every year. So remember to treat yourself the day before Valentine's Day, even if nobody else does.
Absolutely. Yep. So welcome again, everyone, to our February Health Equity Workgroup meeting. My name is Cesar Coyote. I'm the co-chair along with, I'll let, go ahead.
Christine Stewart.
And Kim and Taylor, if you're on, if you would like to introduce yourself as well.
Hi, everyone. I'm Kim Stinchcomb. I'm the manager of the Healthcare Action Coalition with the Health Department.
And hi, everyone. My name is Taylor Palmer, and I have the privilege of also assisting the Prince George's County Healthcare Action Coalition.
Wonderful. Thank you. And thank you to everyone joining. Do we have anyone here who is new with us? If so, please feel free to unmute yourself and introduce yourself. Okay, so welcome everyone again. We can go ahead to the next slide. So for this afternoon, we do have a few points that we will be talking about today. We have the HIAP, or the Health in All Policies, Health Equity Champions Refresher. So we just going to review a few things that we've been working on in the past, talking about the Health Equity Champions Learning Objectives. So we're turning this into a working work group meeting to try and establish some learning objectives to the Health Champions program that have been fleshed out by the University of Maryland Health Think Tank. And then we'll move forward with our community announcements and talk about our next meeting in March. So for every meeting, we do like to start off just to make sure that it's at the forefront of our minds in terms of talking about our vision. So the Prince George's County is a place where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender identity, or health literacy skills. Okay, and so the next couple of slides will just briefly touch on, what exactly are we doing today and why we're doing it today. And so we've had a work plan that we've worked on for the past few months or years rather. And so we want to make sure that, what we're doing, we're doing it with intention to ensure that what we're working on is in line with some of the things that we're working on. Of course, there's always room for change. But today, our focus area, we're going to highlight goal number 1, to advocate for the implementation of health in all policies that came out of CR 127-2020. The first objective 1.2, by December 2025, train 50 residents or community leaders in HIAP health equity concepts, empowering them to speak to the Board of Health about their health equity priorities. And strategy 1.2.1, by May 2024, collaborate with the University of Maryland Office of Public Health Practice and Community Engagement Terrapin think tank to develop a health equity champions curriculum. And so we're already on a great path of implementing our objective and strategy with the creation of the Health Equity Champions program. A lot of that came out of the RAND recommendation report. You can go on to the next slide, please. That was um, implemented and developed, I want to say about 2020 or 2021. Feel free to correct me on that date, Christine. But the RAND recommendation report assessing health and human services needs to support an integrated health and all policies plan for Prince George's County, Maryland. And so a lot of great recommendations came out of that. And so how we'd like to move forward with that is working with those recommendations to do just that. And I believe the next slide talks about the health in all policies concepts that I'll turn it over to Christine.
Yeah, so one of the, and just so some backgrounds, we used to have subcommittees of this work group. We did collapse it all. There was a health and all policies work subcommittee, and overall, the goal of HIAB, if of those of you who are not familiar with it, is to emphasize the need to collaborate across multiple sectors to achieve better health outcomes, understanding that health is not just the sole responsibility of the health departments, doctors, that there are lots of other entities that impact our health. Could be parks and planning, could be um, it could be um, a justice and the police department. So there are plenty of planning department as well. So it's an approach again that where the processes through which policies are created and implemented are seen through the lens of multiple sectors and not just the health sector. So the goal is again to ensure that decisions and policies made and implemented by government agencies have neutral and beneficial impacts on the determinants of health. So if you're familiar with the social determinants of health, this is where it goes. So I mean, your housing, your with your ability to get food, all of these other, your ability to exercise, so walking, having safe paths to walk to exercise. So all of these things impact our health, and that's why the focus on health in all policies, and really it involves the community and policymakers to shift their ideas around health, to really understand that it's everything, and it's not just the sole responsibility of the health department. You can go to the next slide. And so ultimately, several iterations ago, there's several, I mean, the work group has gone through lots of changes, lots of different people have been at the helm. Many people at about 3 years ago, I want to say, wanted to develop a health equity champions program so that others in the county can learn more about the root issues impacting the health of Prince George's County residents, by increasing awareness. Those that would be training would also talk to others, talk to people in different sectors. We know that increased civic engagement and advocacy around community really does impact the health of a community. And so that's one of the goals of the Health Equity Champions program. Go to the next slide. So ultimately, so the two basic goals, or well, the goal for the program is to engage and train community members to advocate for health equity. So this isn't necessarily just those of us around this table, those of us who do this daily. We want others engaged and understanding health equity, and all the different aspects of that can impact health. So by building basic understanding of how county legislation, budget process, and government works, and then ultimately increase the number of residents and community stakeholders who have an understanding of health equity, social determinants of health, and how utilizing a HIAP framework can improve health outcomes. And so one of the, and Cesar already mentioned this at the beginning, one of the things that we'd like to do today is to go through the learning objectives for the curriculum. We realized a while back, and we dived into the group itself, dived into actual curriculum, and we hadn't yet established objectives for each of the modules that were established. And so, as somebody who does training, I thought it was important for us to kind of establish first as a group, to going back to some of the backgrounds on the concept of the Health Equity Champions program. What are some of the key things that people need to know in each of those different modules, and what are the outcomes that we're interested in seeing? So it was hard to develop when I was reviewing the curriculum. I found it difficult to kind of say, well, what should be in there, what shouldn't be there, without us first, as a group, deciding what are the outcomes that we want in each one of those modules. So, Mr. Sacer, did you want to take a little bit more, tee this up as well?
Sure. So in each of the four areas, there's module one, overview of health equity, module two, quality health information, module three, crafting and delivering the message, and then module four, promoting health and wellness in community. Um, the Maryland think tank really did a great job in taking a look at the curriculum that was created in Project Share, and and really developing a curriculum that would apply to Prince George's County, to apply to the work that the Health Equity Work Group is trying to accomplish for the people of Prince George's County. Um, excuse me. And so I'm not sure, Kim, if everyone has access to the PowerPoint just as yet, or maybe we can share the link to the modules in the chat. But we may not be able to get through each of the modules today, and that's okay. Um, but if we could take a look and, module by module, take a look at the curriculum and establish some learning objectives. So what do we need to add or remove to address the goals of the curriculum? What are the most important aspects of each topic? How does this address Prince George's County? And these are some things to think about as we're taking a look at the learning objectives, or as we're taking a look at trying to create the learning objectives. Are there specific examples or use cases that we can pull from to enhance the learning experience? And who is the best representative from the community to address these topics? So essentially, in creating learning objectives, if anyone hasn't created any before for a presentation, a talk, a curriculum, basically you're asking, what is it that I want my audience to know, to understand, to identify, to summarize? What should they leave knowing from the curriculum that's being taught? Um, and basically, we can formulate these learning objectives based on the information that's the curriculum that's been developed in the modules. So I would say if we could go to maybe the next slide. Yeah. So this is an example of the learning objectives that was provided in the curriculum for Project Share. Um, And as we can see here and towards the bottom, it has objectives. So by the end of that project share curriculum, whoever had that module or whoever went through that module should be able to define and explain the concept of health disparity, analyze how the environment and personal health are interrelated, analyze how specific factors, determinants contribute to health disparities, identify groups that are most affected by health disparities, and evaluate how health disparities impact people in the local community, so i.e. Prince George's County. If we take a look at the curriculum that the Health Equity Think Tank developed, what are some objectives that we should create for our own Health Champions program to state what we want people to walk away with at the end of the Module 1 training? So I'll name an example of one that, I came up with. I think it was the very first agenda item. So one of the learning objectives, for example, could be define the concepts of health equity and health disparities.
Bear with me one moment. I'm going to unshare my screen and reshare so that I can edit while we're collecting feedback from everyone.
That would be great.
And I do want to acknowledge the work that several work group members have done on the curriculum and outlining some of the work. But to what Jose noted earlier, we realized that we didn't have firm of like, what are the outcomes? There's a lot of great content, but with limited time, what are the core concepts that we want the audience for this Health Equity Champions program to come away with?
And it was a minor oversight, but we realized it was a big one in the sense that, we'd like to be able to know how we're able to measure, if anything, what those who are coming across the program that we're creating, how they would be able to know what they've been able to walk away with.
So I suppose, should we start going through these first 5 and see if there's any edits, and then we can, or if we want to remove any of them, or and then we can talk about any additional objectives that we want to add to address introduction to health equity?
Sure. I was wondering, did you want to share the module itself, or does anyone not have access to it?
They are, yep,
in
Taylor
the
added
chat.
them in the chat.
Right.
Oh,
So if
okay.
anybody's
Okay.
curious about the content, the existing content, it is in the
Okay.
chat.
Okay.
I find that this happens all the time when there's a natural sequential order of things. We always start at the first one. Maybe we should go in a different way. I know there's been a lot of work on module 3, because the Horowitz Center, they did a lot of work there. I think one of the modules that may need some group attention may be module 4. So I'm proposing so when we can start at 1, or we could start wherever we think there may be more attention needs to be paid.
Yeah, happy to move us. And especially, I know we have Dr. Jackson on, so maybe we can go into, well, we have module 2 with health literacy, but then module 3 is more around crafting and delivering the message. And I know one thing that we talked about before meeting with the group was everything is open to suggestions at this point. So even down to the module names, if they don't feel reflective of the information that we want to deliver.
Right, and I know I'd offered in a smaller group that the last module 4, promoting promoting health and wellness in your community, doesn't in my mind, it didn't seem to reflect what we're trying to do, which is really about understanding how the sausage is made in Prince George's County. And so that did not reflect that. So that's the first, if we are, that would be, I would propose a change to the name of Module 4.
So maybe we should start there, just looking at different options for names for module 4. And these are the subject areas within the module right now: introduction to policy, introduction to advocacy, and then getting started with outreach. So promoting health and wellness in your community might not necessarily be reflective of that high level of policy that's involved. So does anybody have any suggestions for something that's a little bit more direct to that policy and advocacy side?
Can we say advocating for health equity in Prince George's County? This right now, for those, I don't know, it seems I see a couple of people in, but it's an understanding policy is one of the first topics. Within there, there's understanding the legislative structure within Prince George's County. Then there is identifying issues within Prince George's County that participants believe need to be addressed with policy. And the next section is legislative structure and process. Is there, so that people understand what the process is in Prince George's County. It goes into county council structure and process. Are there things, so that's why I proposed a change of the name of this module. For those who have been involved in making changes to either supporting resolutions, making policy changes, does this module provide enough substance to somebody who's new to this to know where to start? I see Michelle offered suggested adding state legislative process as things that happen in Annapolis. It also affects Prince George's County residents. Thank you. That makes sense. That makes sense to me. And and thank you, Kim, for starting to sketch out some objectives. And I know we have to massage the language. But yeah, if we are understanding that this may be the lay public is not involved in policy, not involved in public health necessarily, what do they need to do as they're championing the idea of health equity, health and all policies within their agencies to possibly elected leaders? Mm, okay. And so thank you, Anya. Anya says for consideration, how to advocate for health equity in Prince George's County. In case that there be more there, so that sounds like it's more action oriented than advocating. Okay, it's more of a of a step-by-step guidance. Yeah, step-by-step guidance. I mean, I could benefit from that. I'm really seeing myself in this module. So, but it's hard to know what you don't know if you don't know it. And is it always policy or is it something else? I mean, I'm really asking for those who may know. Are there other steps or options that people have to advocate for change? Is that something that if so, is that something that we'd want to or need to include in the Health Equity Champions curriculum here? I
Yeah,
see
share
lobbying.
it says lobbying. Hmm.
But for the most, so for the most part, if we kind of list some of the options, including lobbying, and if there are others, I'm happy. I'd love to hear them. Um, does this feel substantive enough so that people can take actual steps and they would know? So defining advocacy and policy. Okay. He can also capture, understand, and be able to explain several different ways that individuals can advocate for a cause. Describe why advocacy is important in a healthcare setting, which I don't think is content that is currently in here. And argue for a solution to a problem that they have identified in their community. Any comments, suggestions? And we know
And
this
I
isn't
would,
going to be.
yeah, sorry. I would just say that the way the objectives are written now, according to the University of Maryland Project Share, it's like all these steps and objectives are just in ways to engage the learner. So they will actually create an argument for a solution to a problem they've identified. But if we have other specific examples from the community, from Prince George's County specifically, we can also kind of put those as a side note. So if we have examples in Prince George's County of how we can describe why advocacy is important in a healthcare setting, we can put those down as well. That way we can make sure we're focusing on them.
Hmm. So, I mean, I'm also looking at some suggestions in the chat. Um, Michelle offered advocacy in different settings, not just within the county council, but within county agencies. Yes. Mm-hmm. And Zersacer had another option for the name of the module.
And I
Okay.
added in the community, so taking us back to last month, our discussion from Caitlin and Project Leap on health literacy and how to reach different populations. We know that she said a lot of different groups said that they get a lot of their health information from their community. So I think even teaching people how to have those conversations within their community, if they're not speaking on a legislative session, it still counts as advocacy and lobbying. So I think that if we can empower people to have those conversations as well in the name of health equity, that is also serving us well.
Anya suggested also adding, yeah, thank you. Let's see, executive. All right. Is there anything else missing? So I think, yeah, I think starting off with, okay, what do we need people to know first helps in identifying the content. So we may come back to the group to kind of continue to flesh out some additional needs. But this, I found this helpful for at least this module. Are there any additional considerations or comments? Anything that's missing from module 4, which was now really the advocacy, like how to do it. Thanks, Michelle. Michelle says she likes the coalition building at the end of the module. Mm-hmm. It is definitely a team effort. Looking at the chat. So I see, do we have concrete ideas for advocacy work with county executives and the county agencies? I don't see that. So, Kim, I mean, so the group can still add comments to the actual module content, right?
Yes, the Google documents are still open. I think within our next steps would just be coordinating with the team if there's any major shifts in the objectives or any new information, and the team being the Terrapin think tank, if there's any major sections that we need to add or address.
All right. So it seems like I think we've made a lot of progress with this module. I invite you all have access to, I invite you to just grab the links to those bookmarks. If you think of something later on, to each of the modules, I'm sorry, certainly feel free to add comments for things that we may need to consider. Does anybody need any more time or want to spend any more time on this module? Can we go on to another one?
I think this
Alright.
looks good, and then we can flesh out the objectives to indicate them more in a statement of our outcomes for the modules. But this is good.
All right. Let's see, Kim has module 3 up. Is anybody any comments on this one? 3 is about public speaking, engaging, developing persuasive presentations to your target audience. Is this
Yeah, overall, I think it's clear. The title, I will say I was a little, I'm going back and forth on, primarily because initially when I read it, I viewed it as just the title alone. I viewed it as like developing actual messages for content. But then, of course, the components of the module are about public speaking and things to be mindful of when communicating to the public. So I wondered, is it communicating to the public, or is it crafting, or maybe is it still crafting and delivering the message to the public? But I guess I didn't see even the details of concepts that we typically apply when crafting a message, like, you know, the most important information first, and then hierarchical, and you know, plain language, and thinking about, is it informative versus persuasive, or a combination of the both. So I was like, is this presentation more so about how to equip an individual with public speaking and persuasion as it relates to health information? So I guess, yeah, that's my question. What is kind of the takeaway that is the goal of this module primarily? Is it more the public speaking side, just overall? Because when I was looking through the modules, that seems to be the kind of the takeaway primarily.
so? And I think that's one of your question is like what the reason why we're here, kind of to outline. So what are the key, we have content, but is the content the what we want people to come away with? You know, we unfortunately kind of did things a little backwards. So I think your question is spot on. This is a lot of content on public speaking, positioning your message, speaking with impact, developing an elevator speech. Do we have enough? Oh, I'll hold my thoughts. Just want to hear from everybody else. Considering the overall goal of the program, the Health Equity Champions program, understanding like we have, which is to increase awareness of issues or some of, well, not the goal, but we are to engage and train community members to advocate for health equity. Are we, with this content, are we equipping them to be able to advocate for health equity?
Yeah, and I know that when Dr. Bauer and I reviewed it a couple of months ago, because of the extent of it, we were only able to give so much, and then also we didn't want to like do a total revamp, because it was like, okay, you all's intent may not be how we're perceiving it. So I guess the biggest takeaway that I get when I review the Google Doc in comparison to just the overall, it seems like it's a lot of tips on public speaking, like public speaking 101, and they're providing scenarios of public speaking in some health contexts, like when they give that PTSA lunch room situation, but not necessarily like specific health equity or specific health messaging, like communicating health information. And so I'm not sure if you all feel that that is more beneficial to the audiences who receive this, to have more of a public speaking 101 and then applying all of the other modules to this skill set, or is it much more specific to communicating health information through various channels? So is it like public speaking, social media? Now, granted, that's totally different content, new content, but I'm just curious, what is the goal?
I feel like that's where we kind of get the variance is we're more focused on promoting health in all policies and teaching people to be prepared to do that. So I almost question like number 4 here, is it necessary for us to teach participants in this about designing an effective PowerPoint? Maybe, but do we think that that's the direction we want to go, or maybe we could replace that with something more focused on integrating health in a message that isn't about a typically health related topic. So if it's like a transportation legislation around transportation, how do you integrate health into that topic?
Right. Right. I'm thinking back to, was it Christine maybe who mentioned this earlier about social determinants of health? I think someone talked about social determinants of health earlier.
Yeah.
How would, like, exactly to your point, Kim, like explaining to individuals how they can communicate how transportation is a social determinant of health and can impact health equity and health outcomes, right? And like getting individuals those types of skills, is that the goal? And something that I was thinking about as you all were talking about module 4, but I was like, I don't want to take us down a rabbit hole, but as you were talking earlier about social determinants of health, I always share with my students and colleagues, and even what I try to apply in my own work, is this health equity lens and these modules of like these questions or checklists or things that you should ask yourself, that are connected to social determinants of health when you are trying to either design a program, design messages, develop services, or communicate to individuals about how these determinants of health impact those health outcomes. And I think about, like, because I'm in one of my primary research areas is digital health, and I always give the example to my students that, we can give someone a mobile health app, but if we are not thinking about the determinants of health, such as internet access, digital literacy, literacy in general, health literacy, that tool that was supposed to address this particular outcome is useless. And so I wonder if that is kind of the goal of like how to communicate those social determinants of health and how they advance health equity.
I mean, I think so. So, I mean, when I initially got involved with the Health Equity Champions program, that's what you're mentioning is what I envisioned, because it started out of the HIAP subcommittee. So we want people to understand how all these different sectors really do impact your health. So I agree. But right now, that's not how that module is framed. So it would need some work. And I know Sacer also mentioned in the chat, do we want to focus on letter writing? So my question about module 3, are we setting folks up in module 3 to be able to take the actions that we talk about in module 4. So I mean, yes, I mean, to some extent, but it's so ground level. I think we still like, are we able to? I think it also depends on the type of audience who we have. But maybe we can help make that link to what you said, the social determinants of health. What is, how are these non-health related sectors really impacting health? But then, and as well, have other really prepare them that like this is how you talk to this is how you can talk to transportation or planning or I'm losing. I can't think of some of the other ones, but that may be helpful as well. Yes. So I said Anya mentioned would be great to have a list of various messages. For instance, a quick elevator talk, formal presentation, public speaking opportunity, letter to an official, budget legislation testimony, email correspondence, so participants can choose which modes they may be most useful to them, and maybe a templates or a toolkit. So, yeah, I like that idea. Michelle, I think your hand was raised earlier. Sorry about that.
Oh yeah, no, it was, but I reconsidered my comments. I put it down. But I mean, I like the module, but just thinking back, the different discussion pieces and the last module we looked at, like thinking of like coalition building, and I think some of these might just be able to kind of put in a little caveat, but like all of this seems very much directed at our, I guess, end user. So like if we're, in front of the Board of Health or in front of the county executive, but there's a lot of steps before we get there too. So like, how do we do elevator speeching to people we want to bring to a coalition, or how do we even start, like, doing this with our neighbors, our friends, our colleagues, just looking at, how do we tailor this module to all of the steps of module 4, because I feel like this one has, and rightfully so, right, like, how do we deliver this effectively in front of the Board of Health? That's important to know, and it's an important piece, obviously, but I think there's a lot of steps before getting there that we might be able to incorporate into this one.
Yes. So Anya offered horizontal connections as well as vertical ones to officials. Yeah, and that is really important to kind of build community, build coalition. Other thoughts. So, that's a lot of learning objectives for one module. I would offer that it may be too many. Yes. But or maybe we need to split it into more than one.
So, and then I'll just quickly comment, and that's kind of the beauty of being able to structure and restructure these modules, because we don't have to stick to 4. If we need to expand it to, create another module so that there's there's going to be synergy amongst all of the modules. I apologize, I have my camera off. I will say that I'm picking my daughter up from school. We can definitely expand to another module so that one, it doesn't seem too overwhelming in one module, and then two, that each of the modules have their own succinct and clear messaging on what we would like to deliver with each module. We can vote on that. If we want to stick to 4, we can stick to 4. But that was just a suggestion.
Certainly makes sense. And actually, starting backwards, I feel like was actually helpful in this exercise, starting with the policy and what we want them to do. I found that I found it helpful in figuring out what may need to be before that, to prepare them. Um, are we, do we want to continue discussing this one? Or as a group, do we want to move to one of the other ones?
So I can quickly
Acknowledging.
take us through, I think there's 2 other slides related to module 3, just to make sure that we are aware of the objectives under each of those. So the speaking with impact, more touches on those, public speaking. And I think we got some feedback around that already, like how to prepare to talk to many different audiences. And then the elevator speech, which I know was also mentioned as one of those examples of ways to engage community members or leaders. And then finally, the in your own words, which is more of a, I think we'll also, when we get more into the weeds of it, have to, because some of these are more activity based. So depending on how the program is implemented may impact how we can do this. So if it's like an online tutorial, maybe we're not going to have people write their own 2 to 3 minute talk, but if it's an in-person setting, that might be more feasible. So we can always keep them in and edit them as appropriate. Does everyone? And I'm just looking at Anya's message that there's an emphasis on public speaking, and it's a bit different from exploring various delivery of messages. Mm-hmm. And so, I mean, we could even reorder the subsections to be more of like a public speaking and then delivery of messaging.
And so, I mean, earlier I see Anya you'd offered, the quick elevator talk, formal presentation, letter to an official, budget legislation testimony, email correspondence as some of the other options. Um, so module 3 really is about just communication in general. Right. That's what I'm gathering. And storytelling. I think I'm wondering if, there are going to be some things, there's a lot of different options. We may want to look for additional material and resources that they can link to if they want to get additional, want to learn additional information on, any one of those methods. And maybe we're only providing high level overview of some of these methods. I don't know, what does everybody think? Because I think knowing about them and how they can be used would be helpful. And maybe also giving them resources, accessible resources to learn more about each one, because we may not be able to do every single one. And that's just my viewpoint. I'm open to hearing an alternate view. But I like the idea of providing a toolkit, potentially, of sample documents. This isn't objective speak, but I mean, let's at least capture it. Thanks, Kim. Anything else on communication or module 3? All right. Well, I think let's, in the interest of time, let's go on to module 2. I'll give folks a chance to look over the slide without reading it. And this is module 2, quality health information. This is largely about health literacy. And just to frame our thinking again. So the goal of the program is to engage and train community members to advocate for health equity, by building a basic understanding of how county legislation, budget process, and government works. And ultimately, we want to increase the number of residents and community stakeholders who have an understanding of health equity, social determinants of health, and how utilizing a HIAP framework can improve health outcomes. Wanted to frame. Michelle?
Bit of a clarity question, really. And don't get me wrong, I think health literacy is extremely important, and I think we could do like 20 modules just on that. And I'm not even the subject matter expert on it here, but I'm just wondering why it's here. Like everything is talking about advocacy, and I feel like it's one piece to a much larger puzzle, but I almost feel like the puzzle overall is what needs to be here and not singling out one piece. And maybe it's just I'm missing something. Like we've talked about like the SDOHs, and I feel like we could almost do a module on each SDOH and still fall short. So I think it's more of a clarity question for me personally.
And I don't have the answer. I'm listening to what you all say. I have my own thoughts, but go ahead, Sharon.
So I don't have an answer for me for Michelle. But I guess my thinking is that medical terminology is less important than understanding what the broader the data says. I mean, you have to, I guess, put it into context. Put the literacy into a context that says we're looking at population health. In order to understand population health, you have to understand certain terminology, and in order to do that, you have to understand what the data is saying to you. Data, I'm not sure if I'm being completely clear, and I think I am aligning with what Michelle is saying about it's because of the use of medical terms, I think, and it should be sort of health-related terminology maybe, or population health-related terminology, which may include some medical terms, but it's not necessarily focused on medical terms. Does that make sense?
It does make sense. I think I'm having the same reaction, and sorry, I joined late too, so I'm sure I'm like missing a ton of context, but I had the same reaction to like medical. I feel like health literacy is such a complex topic, like to understand, and I have like real beef with the words health literacy, but it makes us think that like it's on the patient to learn how to understand information or to like be more educated, but really it's like the whole system. How do doctors communicate? How are patients empowered to like be their own advocates in a healthcare setting, or ask questions that they might have, or like how, so there's so much in health literacy. I feel like that's why your question, Dr. LaRue, makes so much sense. Like, what specifically about health literacy are we trying to get people to leave with? And then how do we communicate that in this very condensed sort of format?
So if I could just jump in, I appreciate everyone's comments, and I'm so glad, Caitlin, that you just brought up about the onus on the individual. So that is actually the misunderstanding oftentimes of health literacy, in the sense that it's primarily at the individual, their personal health literacy level, when in fact, the Centers for Disease Control and other health literacy scholars and advocates are pushing towards that we focus on not only individual level, but the organizational level as well. So what organizations and institutions are doing, and there's actually a definition specific to organizational health literacy that focuses on enabling, creating systems to help individuals to easily access, find, understand, and use health information to make their decisions. So it's the responsibility of these institutions, or those of us that are sitting around in this work group, that are determining, okay, how do we ensure that we are making information accessible, understandable? So all the things that you all are talking about, medical terminology, numeracy, all of that, how are we doing that? And which is the basis of the Maryland Consumer Hub that was established in the Center for Health Literacy this past year through the state under the HB 1082 policy. So you all are actually speaking all of the things that I know oftentimes it can't, health literacy could seem a little challenging to understand, but it really is the underpinning of individuals' health outcomes. And there's so many pathways that demonstrate that at multiple levels, whether it's in our non-clinical spaces and in our clinical spaces, where health literacy plays a huge role. How we look at a health insurance, how we look at labels, how we understand what Dr. Fauci was talking about the COVID vaccine, during that time period. So I will just offer that maybe it's about clarifying what are the objectives. Maybe it is being a little bit more to the basics of health literacy, and what that is that you might want your audience members to take away, because focusing on definitions of medical terminology, that's very specific. But is it more important at that organizational health literacy part of how are we ensuring that community members can easily find information, understand that information, and then use that information and services to inform their decisions and actions for themselves and others?
All sorts of hands. So I see little tiny, I see hands over people's faces and I don't see names. So I apologize. Like at this point, there's so many people. um, can't see name or face. So
I can go take
ahead.
the leap. Hi everyone, my name is Layla Dotson. I'm semi new to the working group here, so if I haven't met you, lovely to meet you and be working with everyone. I had a quick question. So at the beginning of this, I think the impetus for this all of these modules is really advocacy, and I'm curious if at any point we break apart and really define what advocacy means, whether it's supporting a specific piece of legislation or, asking like a hospital system to allow doulas into the room when women of color are giving birth, or working with pharmaceutical companies on, strategies to partner with community leaders to build trust and increase clinical trial diversity. I'm at any point in the PowerPoint or is there a space where we kind of explain what we mean by advocacy so that the end user can really see themselves and their own experiences and in kind of like a use case, if you will? And I'm happy to clarify if that question doesn't make sense.
No, it makes a lot of sense. I know. So we started off kind of backwards, and so if you scroll up to the top, Taylor had linked all the links to all current modules. We started with module 4, which was more about policy and advocacy. So what you're saying would fall within there. Whether or not there's specific use cases like as detailed as what you've presented, probably not, but I think that's an amazing idea. Um, and again, for those who joined a little late, if you have any feedback on any of the modules that we're going through today, we're specifically focused on like figuring out what the objectives and the key outcomes that we want the the health equity champions to come away with. But as you're going through the content, please do offer feedback and your comments as well. So I mean, I think we were
You're
talking
a
about.
baby.
Go ahead, Sharon.
No, I was talking to my dog. Sorry, I didn't realize I wasn't muted.
It didn't seem to fit with the conversation, but it's okay. I'll defer to a former co-chair. Um, so I think we were talking, we were on number 2, right? And I think there were some questions raised about the fit, and whether, so, and I think I wanted to go back to original. So what sort of health literacy, what about health literacy do we need these champions who are going to be championing and advocating and raising awareness? What do they need to know in order to effectively talk about health equity, health in all policies, and what do we want them to be able to share with others? That's what I think we need to boil that down to. I admit that health literacy is important, but what is it specifically? And so the objectives at the end, what do we want them to come away with? There are some objectives here right now.
Yeah.
Is it what we agree with? Are these objectives going to help support these health equity champions be able to raise awareness about health equity, health in all policies, and champion that within various spaces across the county?
So I wonder, is it that you want the participants to walk away with how health literacy actually impacts health equity and what their role would be in communicating how health literacy impacts health equity outcomes or health equity policies? Is that the goal of this module?
I believe that's what we're trying to establish. We're trying to establish that. I'm comfortable with silence and for people to process.
No, I mean, I think going back to the question I posed before, I think now reading more the objectives and hearing some of the other discussion, I think I have more of an issue, I guess, with the title. And I had a very narrow definition of how, I always see health literacy. And I don't know if I don't have any suggestions on a new title. I don't like to suggest things without a possible solution, but there it is. But I think this is important, but I think there's also so many different layers to it, because it's how do we level set within those taking these modules, but then also how do they use these tools and how does it apply to so many different aspects? I don't know. I'm just getting entangled in my own head right now.
Hello, everyone. I'm Tamia Shiri with Luminous Health, and I have my hand raised, but because I was off camera, no one could probably see that. I just think it's kind of important to take things back with health literacy and just look at, the definition, when we go by the CDC definition of, of health literacy and looking at, it's the individual's ability to find and understand the information that they're seeing. So, whether that be in a doctor's office or that be outside in a communication, it's to be able to find the information and then understand the information. So I think in that aspect to this module, when we're teaching it or when we're trying to put this module together, there has to be a sense of empowerment that we would encourage people and empower them to ask those questions when they're with the primary care provider or wherever they are, about their own health. And that's the part of education, but also being able to find the information that they need. So I think another thing that we should be able to put in there are some of the resources that we have available within Prince George's County, or where they can find those information, so that they know the right place to go to, and not have to Google everything, because we know Dr. Google is not the best. Um, but having that sense of empowerment to ask those questions when their primary care provider, if they have the when they have, when they go to see their primary care provider, but also where can they find the information that they need, and where can they find those services that they need. I think those are part of the empowerment with health literacy.
Thank you. So, Dr. LaRue, you mentioned you had a problem with the title, but actually, now that you mentioned it, I'm wondering, is that the title that we actually, I'm actually, I'm viewing this at a different lens now too. Um, because ultimately we want the champions who may not be part of, they may not be enmeshed in public health, healthcare, like many of us are on a daily basis. So we do want them to be able to go away and know how to research, find quality health information on their own. So as somebody who's not a health literacy expert necessarily, what title
But
or what words kind of resonate more?
yeah, I mean, but we're still looking at all of these modules from a health and all policy perspective, right? So I'm thinking like, my brain always goes the medical route. And so I'm trying to, make sure to pull out of my own brain as well. Like if I'm talking to the Parks and Rec department about health and all policies, it's not only that, parks are good for our health, but it's also about public safety at the park. It's also about accessibility of, for all able bodies to be able to access the park. Like there's so many different layers. And I find health and health literacy supremely important, but it's a sub piece of a sub piece of a sub piece when you're talking about like the medical interactions between patient and provider. And it's obviously critical there, but like looking at health policy in this health in all policies or health literacy in a health in all policy realm, I think it's much, much broader than that. Like looking at if I'm talking to the Department of Sanitation, or if I'm in front of the county executive, or I'm from whomever, like how do I bring health literacy, but in a health and all policies perspective to this? And I think to some, I don't know if it was Sharon or who brought up, like also in, in the construction of the messaging, like the research, the language, the, all of that piece, I think it all just comes together. So I'm thinking something a lot broader than health literacy as the term, but I'm at a complete blank on what that term may be. At least that's where I'm at with this module.
That makes sense to me. I understand. I understand where you're going, Dr. LaRue. I don't have the answer in terms of the title, but I'm tracking. Does that resonate with others? I can't see. I see some thumbs up. Okay. Okay. So, and maybe this is Dr. Jackson and others. So I mean, is there, so we're used to talking about health literacy, but what is it like? So is there a broader term that's more applicable?
Um, I would have to think about it. If, as far as if you want to go broader and not have this specifically focus on health literacy, but health literacy just be a component of the module. Yeah, I would have to think about it. Think about that. And this is giving me more context hearing everyone's discussions because I joined the group, you know, later in the fall. So hearing that it needs to fit within the context of policies, all policies, I definitely hear that. I guess I'm tying back to even just like the state of Maryland and their policy that was enacted as it relates to health literacy. And so I would need to think about it because, so I guess my question is, as I'm thinking through this, is this module going to be is the focus going to be health literacy, or is it going to be refined to where health literacy is just a component of it?
Hearing, at least what I'm hearing from some, is that there's a desire for a broader focus. Well, I guess that's a little bit broader than just health literacy. But correct me if I'm wrong. Anya, I see your hand is raised.
Thank you so much. Just wanted to pinpoint in legislation CR 127 that we briefly addressed earlier, there are actually components that speak about very much developing some sense of, like common knowledge base so that everybody can move forward with implementing health and health policies. So for example, it says for the Board of Health, initial steps is to arrange for and participate in structured training to develop a common knowledge base and framework for addressing health through an equity lens and obtaining information on nationally recognized best practices, and then it talks about, like establishing priority areas, realistic measurable goals, like so on and so forth. So all of those, how to say, decisions and steps, they require some sense of common knowledge in this field. So just wanted to bring that up to tie it back to the importance of decision makers, like understanding how to use this terminology and whatever information comes their way. Thanks.
Thank you, Anya. And I see that you did in the chat also said that you're interested in decision making, understanding of basic terminology so that they can understand data, material, etc., to make informed decisions. So with that, which one of these modules would that fit in? Is it module 4? Or is it
So
maybe it's
also,
module 3?
yeah, also if we want a module to focus on these goals of health literacy, that's fine. And then I think the other piece of module 2 is cultural competence. So that could be separate. We don't have to house them under like this title of quality health information if that starts to get too troublesome.
Yeah, I probably would put this together with module 1 or separate. I mean, we may add, but this doesn't seem to fit in my world. But I'm open to hearing other perspectives.
Sorry, just to chime in once again, just had a quick idea with regards to what if we look at it like from disparities perspective, and what are some of the drivers of disparities, but instead of looking at social determinants of health, like look at it from like perspective of like of literacy, of cultural competence. Some of the factors that obviously contribute to inequities, as like, and something that we can influence to achieve greater equity. Okay, just an idea.
We have about 6 minutes left. Did we want to save? So I know we usually do some community announcements at the end, or we can try to touch. Well, one, I just want to make sure that we feel comfortable with what we have so far with module 2. But it does seem like we still may need some discussion. Zersacer, what are you thinking?
Yeah, absolutely. I'm, taking in a lot of what's been discussed, and just continually brainstorming as well. So we can definitely plan to continue this discussion for March. Um,
Would it be helpful if we kind of compile everything, really just the objective side, into a document and allow people a chance to digest it and maybe put their own markups? I know everyone's had a lot of homework with marking up the actual module content, but we know this is really important to get us to keep it moving forward. So if that's helpful, we can compile it into a document and send everything out with the notes for everyone to just take a step back and look over. Okay, I'm seeing some head nods, some thumbs up. Okay.
Thank you. That would be helpful for me.
Yeah, and it looks like there was a question in the chat about meeting prior to the next meeting. So that's a great question. We had talked about initially creating like subgroups to work through some of these modules. And it sounds like, we're getting really great discussion as we're working together on these, and we're being able to bounce information back and forth between one another. I'm open to meeting prior to March. I'm not sure what everyone else's schedule, kind of looks like. But we can take a poll, maybe, Kim, and send that out to the group about availability if meeting prior to the next meeting, just to kind of keep the momentum going. Uh, that's perfectly, I'm open to that. Christine, did you have thoughts on that?
No, I'm happy if that there's interest and momentum. I know we previously had subcommittees, but during COVID, there was people were stretched, so we did come together in a work group as a larger work group. So if there is interest in working in between meetings or doing another meeting, I'm happy. All right. So seeing that it's 4:27, so Kim, if you can help with a poll and sending out the objectives in one document for us all to comment on, that would be wonderful. Any community announcements? Any announcements from any of the participants here today about your programs, something happening at your organizations?
I know we have just not that much time, but I just wanted to share that the Maryland Consumer Hub in the Center for Health Literacy at the University of Maryland is offering all local health improvement committees, as well as other organizations in the state of Maryland, up to 5 plain language reviews for health, safety, insurance, and social service materials using our Maryland plain language checklist. And we will also provide an evaluation and recommendation for improvements. And this work is in alignment with the HB 1080T bill to bring more plain language and language accessible information to our Maryland residents. So if anyone is interested, please feel free to contact us. And I'm also going to drop the email in the chat box.
Dr. Jackson, quick question. Does the material have to be in English to participate?
No, it does not. We have we have a team member who is taking the lead on our Spanish speaking materials, and we are working on also a process for Asian communities and various languages. So we can assess to determine if we have the resources depending on the materials that you provide.
Is there a checklist or other resource tools online that we could look at ourselves?
Absolutely, and I will drop in the Maryland Consumer website for you to take a look at all of the resources that are available and our services. Dropping that in the chat box right now.
I suppose you can't force insurers to use your tools, huh?
We can't force anyone, but we are, strongly encouraging. And hopefully you will spread the word as well that they seek out our services.
Thanks so much, Dr. Jackson. Oh, sorry, Xerxes, sir.
No, go ahead, Kim. I was just going to say thank you so much, Dr. Jackson. And go ahead. I think, is there another announcement?
Just one other announcement I wanted to share. The Maryland Health Benefit Exchange reached out and let us know that they're recruiting for the Standing Advisory Committee. So their mission is to improve the health and well-being of Marylanders by connecting them with high-quality, affordable healthcare coverage. And the committee is the primary stakeholder advisory group. They did mention that they meet about 4 times per year in the spring to the fall to talk about policy matters. I know Dr. LaRue was previously a member. Dr. LaRue, if you want to make any comments for anyone, but also, if anyone is interested, there's a brief form, and then you submit your resume or CV to the contact here, and they can follow up with you.
Yeah, I mean, just to give my own 2 cents, I found it really worthwhile being on there. We do manage ACA certified navigators too. But it's just a way to stay informed. It's a meeting once every 2 months. They do tend to get into the minutia, like talking about actuarial stuff that even flies over my head sometimes of like the cost of health insurance and whatnot. But it is a great way. I mean, Michelle, who's the CEO of MHB, Michelle Eberly, is there every time, gives us an update. So like when the MEEP program was first enrolled, I felt very informed about that. Healthy Babies was a more recent one. And so I appreciated always being part of this, not only to stay up to date with things, but also an opportunity to give back feedback and information or ask questions to the team. So there is the board of trustees, and this is basically an advisory board to the board of trustees. And I just appreciated having that kind of direct connection to MHBE, and even on the policy side and the implementation side of things.
I see your hand raised.
Thank you. And sorry, I know that we're out of time. So 2 quick things. Just wanted to let you know that we did have a first Board of Health update this week. And generally, the new council chair, Ms. Ivy, she plans to have a more active Board of Health this year. So we have 2 full meetings scheduled for May and October. In addition to that, we anticipate to have monthly updates, which will be primarily from the health department. Also wanted to note that I, like as a Board of Health advisor, still working on figuring out how exactly I can work with you guys more closely to solicit input on the variety of priority areas that we have. So those communication channels, they have not exactly been established yet. You're a wealth of resources, and I really wish I could get feedback pretty much on every priority that we currently have. So we're working on that. And in addition, we do have specifically health equity through health and all policies as one of the priority areas. And once again, once we get to addressing that, I would love to have like an official testimony from the group, and still working out as to what permissions exactly I need to get to be able to realize that. So that's just FYI with regards to the Board of Health operations. So we have high ambitions, but we don't have the exact connections and and communication channels in place yet to enable that. Thank you, guys.
Thank you, Anya. That's really exciting to hear what you're doing and what the Board of Health is doing. Look forward to hearing more.
So thank you so much again, everyone, for joining. This has been a great discussion. Kim will send out a poll for our next in-between meeting prior to March. So please be on the lookout for that and other resources. But thanks again so much, everyone, and enjoy the rest of your evening.
Oh, Dr. LaRue, did you have something?
Oh, did I miss a hand?
Yeah, Dr. LaRue.
She looks frozen.
She may have frozen.
Oh, yeah. Yeah, she's not moving. All right. Thank you all.
Thank you again, everyone.
Good afternoon. Take care.